So now I want to discuss when you are developing a bioinstrument, which is for, let's say, disease diagnostics, then you want to get approval. Then the people who want to buy or commercialize your device will ask you, hey, what's the sensitivity and specificity of your instrument? Then, wait a second, what is sensitivity and specificity? Okay, so we have to know the definition first. So there's a simple 2x2. This is a matrix, and let's see why we need to know about sensitivity and specificity. So that's what people will ask you. So to evaluate the performance of a test or assay or a bioinstrumentation, what you have to diagnose a disease, these are the important parameters which belongs purely to that instrument, okay? So the definition of sensitivity is the probability that an individual who has a disease, we want who have the disease to test positive. That's sensitivity, okay? So how do we define sensitivity? Yeah, the amount of true positive among those who have a disease. So sensitivity only matters for a population who have the disease. So that's disease. And disease composed of true positive plus false negative. From this formula, you can see higher sensitivity means you have low false negative. And false negative means those who have a disease, but result turn out to be negative, okay? That's false negative. So what does high sensitivity mean? That means if you truly have a disease, this device is likely to give you positive result, okay? So that this high sensitivity device will not miss many patients who actually have the disease, okay? Or which means low false negative, or false negative rate. If you take 1 minus SN, then will be false negative out of those disease. So sensitivity really means we are curious about, hey, someone has disease and this test should give you a positive results. That's about sensitivity. Then you can think of the opposite case. Hey, I don't have a disease and I have this test and I want to have a negative results, okay? So that is related to specificity. What it defines is a probability that an individual who do not have a disease will test negative. So that, hey, the definition of specificity should be, hey, someone who has no disease will test negative. So no disease, out of no disease, the test will be negative. No disease is composed of true negative plus false positive, like this. So what does it mean by having highly specific test? Means you need to have very low false positive. And false positive means, hey, I don't have the disease truly, but the test give me a damn positive, okay? So high specificity means infrequently identify patient as having a disease when they do not have the disease. So let's really think about this. So high sensitivity means you are less likely to miss the disease by using this instrumentation. On the other hand, high specificity means this test will less likely to misdiagnose a disease. So it's quite important, but it can be also confusing. So specificity involves only those populations who do not have the disease. Okay, so let me give you a quick quiz. So I will talk about this, both sensitivity and specificity, higher the better. But unfortunately, there is always a compromise, which I will discuss next time. But let me ask you a question. Which ones are more important between sensitivity or specificity? Let's say early stage cancer. And think about the disease of early stage cancer means cancer is very, very important disease because it can be fatal. So early stage, if you don't diagnose well enough, for example, if you miss the early stage cancer, then it turns out to be real cancer later on, and later stage, you already know it's more fatal. So it's very important you do not miss the disease, because you can change, you can treat the course of disease if you find it at an early stage. So if you have a test which will diagnose early stage cancer, you make sure you have a high sensitivity. Does it make sense? Let's think about another type of disease. Let's say there's no a good cure of the disease, no treatment. Okay, so even if you know that you have a disease, if there's nothing or not many things to do for the patient, that will aggravate the patient or give burden to the patient. So here's an example. Let's say Alzheimer's disease. To date, if I know that like I've got Alzheimer's disease, there's not much thing I can do. Then what if I misdiagnose it? So I actually do not have Alzheimer's disease, but this test will give me a positive, so which is a false positive. Then, because of this, I feel, I have to know whether I really have Alzheimer's disease with this test. So I have to undergo, hey, I need a more accurate test, which will be costly. So I undergo follow-up exams, and that gives me more burden. Okay, so but the problem is, even if I'm truly getting the Alzheimer's disease, there's not much thing to do. So in this case, in this type of disease, we don't want to misdiagnose. Okay, so that for those patients who do not have disease, don't want to get positive result. In this case, what matters is high specificity. Hopefully this makes sense for you.